Hello and welcome to tonight's discussion. Please tell us where you're watching us from. First of all, we would like to apologize for starting late. We had a bit of a challenge with some technical issues. So please do tell us where you're watching us from. Also, tell us if the sound is good. But don't worry, we should be able to catch up very shortly. All my guests are here. Dubai is here, and Edward will be joining us later once he manages to join in. I'm also joined by another expert who is a consultant in infectious disease. So please tell us where you're watching us from, and also tell us if the sound is good. Tell us if the sound is good. Good evening. Good evening. Good evening. You're watching us from Lusaka West. Okay, yes, sound is excellent. So very quickly, what I'm going to do is that I'll bring in my guests, and then we can start the conversation. For those of you who have just joined us, the conversation today is that we are hosting a couple. And this particular couple is quite special because they have been living with HIV in their home. And we will be learning from them how they have managed. And on top of that, we also have a guest with me who is going to help us understand the technical issues related to the same. So because we've started a bit late, please be patient with us so we can allow others to also join in the conversation. We are having people joining us all the way from Namibia, South Africa, Malawi. I can see Kenya. This is very good. It's good that we're having people from across other parts of the world as well. That's excellent. You're welcome. We have brothers from Nigeria, Ghana. Excellent. Good to see you as well. It's good that this conversation has received so much interest. So let's see how far we can go. So as we speak, let me introduce to you my guest tonight, Duba. How are you?
I'm fine, Doc. How are you?
You are welcome to this conversation, Duba, and I'm looking forward to Edward joining us as well.
Thank you. I'm sure you'll be able to join us in the course of our interview.
Right. So I am also Duba. I'd like to meet Dr. Mpeta. Dr. Mpeta, welcome. How is Lesotho, Doc? Dr. Mpeta, we can't hear you. I can't hear you.
All right. No, it's kind of raining the whole day today, and
Right.
Zambia was playing Eswatini,
Oh,
and
you are watching football.
very, very difficult. Yeah, there's zone 5 games here. Very,
All
very
right.
difficult weather conditions. Yeah. Good evening.
Good evening. So Dr. Mpeta here is a consultant in infectious diseases. So Dr. Mpeta is going to help us provide context. But the guest for Dr. Mpeta and myself today is Duba. Duba, you are the star of the show tonight. We are all here waiting to hear your story, and we hope that your husband can also join us. But to set the ball rolling, Dr. Mpeta, could you just quickly introduce yourself before we get Duba to introduce herself as well?
Yeah, so my name is Francis Mpeta. I'm an infectious disease specialist, typically involved with all infections, HIV and AIDS, TB, malaria, and recently the emergence of COVID has also thrown us, into that battle. And we are here providing, expertise, not just to the country, but to many other African countries, especially with regards to COVID. And I've had the experience of working in several countries, almost 15 in the African region, providing, expertise in COVID-19. Yeah, but before COVID, mostly I was involved in the HIV program in Zambia, and part of the people who have run the HIV clinic at the Center of Excellence at UTH. Thank you.
Right. And welcome, Dr. Mpeta. We are so excited to have you here. Duba,
Thank you.
who is Duba, by the way? So Duba Sakala, we know you are married. So just tell us who you are. My first question to you, and I know Dr. Mpeta may also have a few questions for you as well. So who is Duba?
Well, there isn't much to to tell about Duba, but maybe in line with what we're about to discuss this evening is Duba is somebody that is living with HIV, and I'm somebody that has started doing HIV advocacy. I started doing HIV advocacy in 2019 when I came out in the open about my HIV status. So I discovered my HIV status in 2001. And Dua has got two children. One was born before she discovered she was HIV positive, and the other one was born when she was already HIV positive. And academically, Dua had studied IMIS, which is information, what's that? Management of information systems. But currently, she's doing community work. So yeah, that's a little bit about Dua. Well, about family background, it's a bit complicated. If I go into that, I'll have to take about an hour to explain everything. Yeah,
Right,
so that's a
right,
bit about Dua. Yes, married to Edward Inkonde, this cornered
right,
couple. My partner is HIV negative.
right. So when did you get married, Duba?
2015.
You got married in 2015.
Yes, though it wasn't a white wedding, it was a traditional thing where you just take lobola and yeah. So traditionally, yes, but we haven't done a white wedding. But it was just an issue of him taking lobola.
But it's a marriage still, isn't it?
Yes, it is traditionally, yes. But
It's a
then
marriage.
kindly, most people think that a marriage is a white wedding. When you put on a
No,
white
Duba,
wedding,
you're married.
they say now they are
No,
married.
No, Duba,
that's the
Duba, you're
Western
married.
type of thinking.
Dr. Mpeta, what do you
Yeah.
think? You still are married.
Yeah, so
You know,
traditionally it was 2015, but we
putting
haven't done any white wedding
putting
yet.
putting on a white gown is foreign. In
Yes,
Africa, once you reach the parents and they charge you and you pay, that's marriage, and that's
yes,
deemed as a valid marriage with full entitlements of any couple. Yeah.
yeah,
So a white gown, really, it's foreign. It's not African. Yeah.
yeah, true. I agree with you on that one.
So, Duba, how old is your firstborn?
Well, I had my firstborn when I just completed my grade 12, and that was in 1995. So he's 26 this year.
Oh, okay. So you
Yeah,
had a
so
child before you got married.
yes, I had a child before I got married, but it was not with my current partner, but it was with somebody
Okay.
else, somebody
All
that
right.
I was dating in high school.
I see. All right.
Yes,
And how old is your second child?
my second child is 5 years.
Okay. All right.
Yeah.
Excellent. So, Duba, tell us. For me, I'd like to find out, like, when you found out that you were HIV positive, how did you find out? And what made you test for HIV?
Okay. So I didn't just get up to go and test for HIV because it's not something that I'd ever thought about. It's not something that I thought I probably would find. It's not a situation that I thought I'd find myself in. But in 1999, I met somebody that proposed marriage to me in 2000, and we were supposed to get married the following year of 2001. So, upon consultations at our church where we were going to, they told us we needed to do, it was more like a mandatory HIV test before we could get married. So 2001 of January, we decided to go for an HIV test, and that was at Cara Counseling then. Because I think at that time, most of these government clinics were not doing HIV tests. So when we went to Cara Counseling, I remember that time the results never used to come out there and then. It's different for now where there's this rapid test. I think it take about 2 working days before they could call you back to go and get your results. So when we went to test, we were told to go, I think, on a Friday for our results. So when we went back on that particular Friday, my ex-fiancé then and I given our results individually. So we were told to say it was really up to us whether we wanted to share our results or whether I wanted to keep them to myself and he wanted to keep his to himself. But then because the fact that we're supposed to get married, it wasn't going to make sense that I would keep the results to myself and then results himself.
Duba, just hold on. Duba, just hold on. There's a bit of noise in the background. Dr. Mpeta, is that your background or Duba's background? We have
Not sure. I've removed it.
No. Is it your background which is making noise? Kulira mapoto mbale.
Looks like it was Dr. Mpeta because
No,
after
no,
meeting
it's
in
not.
Dubai,
It could be mine. It could be mine. Let me.
Dr.
no,
Mpeta,
it's actually yours because after you muted, the sound went.
I acknowledge. Yes, it's almost summertime.
Okay, so Duba, you can proceed.
Yes. So when we were given our results, we were asked if we wanted to share our results. So I saw my results; they were reactive. He saw his results, and they were non-reactive. So I didn't have anything to hide. This was somebody that wanted to marry me, so there was no point in me hiding my results from him. So I gave him my results. He also gave me his results, and his results were non-reactive. He was HIV negative because we had never been sexually intimate. So the chances of one of us coming out positive were possible, and maybe both of us coming out positive was also possible because both of us had been with previous partners before. So when I gave him my results and he saw them, well, at first he was like, no, it's fine. I'll still stay with you. I'll not leave you. I'll still go ahead and marry you. Then we made the decision that the only people that were going to tell about our results were our marriage counselors at church. We're not going to tell our families about it. So we didn't tell our families. And in that very year of October, I had planned for my bridal shower. So dating back to 1998, my mother was quite sick and I was the one nursing her and had suffered from tuberculosis for the first time. So my family attributed it to the fact that growing up I had bronchitis and they thought probably me nursing my mother had taken a toll on my immune system and I ended up having tuberculosis. So we attributed it to that. That probably that tuberculosis in 1998 was as a result of me having been stressed because I was taking care of my mother and having a history of bronchitis. They thought maybe that's why she has had this tuberculosis. What we didn't know was actually that tuberculosis was HIV related. So come 2001, when I was doing my bridal shower preparations, the stress of having to go, run around, making the bridal shower preparations, my immune system, I think, was suppressed again. And I had a TB relapse. So during my bridal shower, I was quite sick. And I was actually quite weak, whereby his family noticed that I wasn't too well. Though we went ahead with the bridal shower, but they had to really make me comfortable because we had already booked the venue, we had already bought the food, they had already done all the preparations that had to do with the bridal shower. So they couldn't cancel it. So they said, we'll go ahead with it. And then probably afterwards, she'll get treatment and she'll be fine. And even the doctor that I was seeing at the time told me to say, no, go ahead with your bridal shower. And then afterwards, we'll start you on treatment because you are both doctors. You know that TB medication can be quite strong. And at first, it kind of like weakens you. Yeah. So I went ahead with the bridal shower, but then his family got concerned and they said, wow, that girl didn't look too well during her bridal shower. Is she okay? Have you been for HIV testing? And at that point, that was October 2001, we went for our testing in January of that year. We had already known our status. He was negative and I was positive. So he lied to them. He said, we haven't yet gone for HIV testing. Then they said, no, you need to go for HIV testing because this girl doesn't look too well. So when he came and told me what his relatives said, then I told him, I said, there's no point in us hiding from them because we already know our status. So allow me first to tell my family. Once I tell my family, then you can go ahead and now tell your relatives about our HIV status. So when I told my family, of course, your family will always be supportive. So they were very supportive and they said, well, these things happen. It's fine. We'll still support you. So now the problem came in when he told his family. So when he told his family about my HIV status, they said, no, This girl knew she was HIV positive. She wanted to infect you. She wanted to kill you. And well, a lot of things were said. So he came back to me and told me, say, no, my family is not okay with the fact that you've tested positive for HIV. And they feel like you knew about your status before you met me and you hid it from me. And I said, well, I was testing for the very first time, and was my witness. I'd never known about my status. I was testing for the first time. Even the TB I had in 1998, I thought it was probably because I grew up with bronchitis, and maybe that's the reason why I suffered from that tuberculosis. So he said, no, you can start your medication. And then after you finish your medication, when you're strong enough, that's when we'll do our wedding. But then came 2002, after I'd finished my medication. TB relapse is 8 months because you have to do the 60 injections, 2 months of injections, and then continue with the tablets. So it was supposed to be 8 months of treatment. So in 2002, I finished my treatment for the TB relapse, and the guy was still quiet about marriage. So I began to suspect that probably something was going on. I would ask him and he'd say, no, I'm still going to go ahead and marry you. So eventually, he said, no, my family wants to meet you with your family because they want to iron out a few things. So I said, well and good. But at that point, I knew to say probably this guy was backing out. So a day before his family came, I sat down with him and I gave him back the engagement ring. And I told him, I said, if this ring belongs on my finger, you put it back on my finger. But if it doesn't belong on my finger, then you keep it. And he took it. And I put it back in the box that he gave it to me. So he took it back. So I knew to say this guy was backing out. So the following day when his family came, they said, no, our son says he can't go ahead and marry your child. And the story was different. He told us it was his family that were not for the idea that he should marry me. But when his family came, they said, no, it was him who did not want to go ahead with the marriage. So that's how my family said, well, it's our child who's not well. So we cannot force your child to marry our child. So if he wants to back out, well and good, we'll allow him to back out. Then they asked, they said, what about the things she received for our bridal shower? What about the lobola, the salamu? What do we do with that? They said, keep everything. We don't want anything. We can keep everything. All we came here to tell you is that our son is not going ahead with the marriage. And that's how the engagement, the marriage preparations were called off. And that's how now I had to start living with HIV and had to accept the fact that now I was HIV positive. So, well, at first, because I thought I had his support, it was a bit easy for me because I felt I had somebody that I could lean on. I had somebody that I could cry on. But then when he decided that he wasn't going to go ahead and marry me because of my HIV status, I had to go it alone. So now I realized to say, well, this man has left me. I'm HIV positive. And you remember in 2001, we didn't have free ARVs in our clinics. I think those that were accessing ARVs had to pay a certain fee, and I didn't have that money to pay at the time. And you had to wait until your CD4 count had to drop. I think it was below 250 for you to be eligible for ARVs.
Yeah.
So I didn't have access to ARVs then. But the good part is I recovered from that tuberculosis and I went on to live a healthy life. But came 2005, that's when I now ARVs were accessible in government institutions and they were free. And that's when now I was put on ARVs. But I had first to suffer from cryptococcal meningitis. And then I think my CD4 count at that point was 44. So it was less than 250. At 44, I had cryptococcal meningitis, which was very severe and almost took my life. But thank God, because ARVs were now free in government institutions, I was commenced on ARVs, and here I am today. So that's basically how I got to know about my HIV status and how I came to be where I am today.
Right. Do you suspect that you could have been born with HIV?
No, I don't think I was born with it because why I think so is because my immediate young sister and our last born are both HIV negative. So for me, I feel that I contracted it from one of my previous partners.
I see.
Okay, so the fact that I never had one partner before I had my firstborn child, I attributed to the fact that I may have contracted it from one of my previous partners. So for me, it wasn't an issue of me being born with it, no. Besides,
Yes.
I don't know, was there HIV in 1976?
No.
Exactly. So, so I don't think I was born
HIV
with it.
started in 1983.
Exactly. So 1976, there wasn't HIV. So it's not possible that I was born with it. I contracted it from one of my previous partners.
Right. Now tell us about Edward and yourself. So this your marriage and your relationship broke down because your partner at the time could not accept your HIV status. They were scared, they ran away, they left you alone. How did you meet Edward, your current husband?
Yeah. So after quite a number of disappointments, because what I decided after my ex-fiancé left me was that everyone that I would meet, I would tell them about my status, because I didn't want to go through, what I went through with my ex-fiancé, where you get to a point where this person has paid in Salamu, you even have a bridal shower, and you have to wake up every morning looking at the gifts that you received for a bridal shower, and yet this person has left you. And then people keep on asking you to say, wedding need it, yeah, because a wedding, you see, because they know you
Yeah.
had a bridal shower. So I didn't want to go through that again. So I told myself, whoever I'm going to meet after now, after this guy, I'm going to have to tell them right at the onset to say I'm HIV positive. And if they want to stay, they will stay. If they want to leave, then they will leave. So after my ex-fiancé, everyone that I met, I told them about my HIV status. And to be honest, it was one rejection after another. So you meet this guy, you tell them I'm HIV positive, and they'll pretend for maybe 2 weeks or so, like they're okay with it, and then they'll come up with an excuse and they'll leave you. So I met Edward in 2013. And when I met him, well, at first we were just friends. So we'd chat as friends and so on. And then when he expressed interest, he told me no, what he felt for me. I told him, actually, I invited him home. So he came home. And at that time, I was actually having my third bout of tuberculosis. Okay. I was suffering from tuberculosis for the third time, and I was on treatment again. I'd finished my injections, but I was now taking just the tablets, and I had the TB card with me. So I sat him down and I told him, I said, well, you're saying you're interested with me in me, but this is my condition. I have HIV and I'm also on tuberculosis treatment. He thought I was lying because he thought it was a way of me trying to push him away. So he said, don't joke about such things. I said, I wouldn't joke about such a thing. So I took out the TB card, gave it to him, and I showed it to him. I said, this is my TB card. I'm taking TB drugs. And I took out the bottle of my ARVs and I told him, and these are the ARVs that I'm taking. So when he saw the medication, that's when he was able to believe that I was actually HIV positive and also on TB treatment at that particular time. So he said, well, it's fine. I'm okay with it. So because of my past experience, I thought he was saying that just to make me feel like okay about the fact that I was HIV positive, and he was trying to buy time like the others would buy time and eventually they would leave. But then months passed, okay, and this guy was still around. Then in 2014, on one of my reviews, my doctor mentioned to me the fact that if I have an undetectable viral load, I cannot pass on the virus to my partner. So I went back and I told him, I said, wow, this is what the doctor told me. And then he said, wow, then there's really no need for us to use condoms. Well, and then I told him, I said, well, so then came 2015. Uh, he said, no, I think I want to spend the rest of my life with you. And I said, okay, well, fine, and all that. And that's when we did all the traditional things where he had to meet with my families. And the same year of 2015, December, that's when he said, I want us to have a child. So I was a bit skeptical at first because I didn't understand what it meant to be undetectable, even though in 2014, my doctor had told me to say, when you're undetectable, you cannot pass on the virus to your partner. I still did not have that understanding of what it meant to be undetectable. So in 2015, after we did all the traditional things and he said he wanted to have a child, I was a bit skeptical because I still felt like no, it was possible for him to get infected with HIV. But he insisted he wanted us to have a child. And December of 2015, that is when I conceived. Came January, did the pregnancy test, and I found out that I was pregnant. So I wish he was here to narrate his side of the story, but I don't know if
We'll wait for him. We'll wait for
yeah,
him.
or hopefully he will join us in the course of our
He,
interview.
I'm sure he will join us. We'll wait for him. He will find
Yeah,
us. Go on.
yes. Mhm. Yeah, so that's how he was able to actually before that, before we even came to the part of him wanting to us to have a child, the very time that he expressed interest in me, I thought probably he was just like these other guys who were trying to comfort me and make me feel like no, it was okay, they can be with me despite me being HIV positive. So I felt like maybe he was also HIV positive, and as a result he didn't have a problem being with me. So what I did is I invited him to come with me on one of my ART visits, my ART reviews. So when he came with me, I spoke to one of the counselors and I told him, I said, well, I would love for this guy to be tested. We had not been intimate at that point. So I said, I'd love for this guy to be tested because he says he's okay with my status, but I'm not sure whether he's HIV positive as well. And that's why he's okay with my status. So they took him to the counseling room, counseled him, and he was tested and he tested negative. Then my friend told me to say, no, he's actually HIV negative. And I was like, then why does he want to stay with me? But well, he assured me he was okay with the fact that I was HIV positive. So after he got tested and he was found HIV negative, and my friend confirmed with me to say, no, he is actually HIV negative. That's when I said, well, then maybe it's his decision to be with somebody that is HIV positive. So that's how I was now able to be comfortable with the fact that he was okay with my HIV status and he was willing to stay with me despite the fact that I was HIV positive. And this is like 8 years later and he's still here. So I guess he's come to terms with the fact that he's with a woman that is HIV positive.
8 years later, he's still with you and you have a child. What is
Yes,
the HIV status of your child, the one that you have between you and Edward?
he's negative.
Your child is negative.
Yes,
Right. And this is a child you had, after you had HIV and you were on ARVs and you were undetectable.
exactly.
All right. Now, how long have you been undetectable?
I got to know about my undetectable status in 2014. So on
Mm-hmm.
one of my ART reviews in 2014, I think that's the time that they really started doing viral load testing. Because before that, I think they'll determine whether the ARVs were working or not on the CD4 count. They were using the CD4 count before that. So they would look at your CD4 count and see if your CD4 count is going up, then they'll say, no, the ARVs are okay. But then I think after some research, it was discovered that actually CD4 count was not a measure of whether the ARVs are working or not. They discovered that actually the viral load was the one that was able to show a true picture of whether the ARVs are working or not. So 2014, I remember that's when I had my first viral load test. And after it was done, I was told by my doctor to say, you are undetectable. And because you're undetectable, you're not able to pass on the virus to your partner. Well, of course, I didn't understand it as much as I understand it now until maybe after doing some reading and probably some research. That's when I was able to understand what it means when somebody is undetectable. So I don't know for how long I've been undetectable, but what I know is I first found out that I was undetectable in 2014. But when it comes to me being on treatment, I've been on treatment from 2005.
Right.
And
Now,
even
now,
though I have been on treatment on 2005, there've been some episodes where I developed some treatment failure due to poor adherence.
yes, because I was about to ask you that. You had been on treatment for some time
Yeah,
and you suffered TB 3 times.
yeah,
And you also had a very serious type of meningitis, this fungal
yeah,
meningitis, cryptococcal
yeah.
meningitis.
Mhm.
Now, generally speaking, when people who are on HIV start developing such problems, it means that adherence to treatment is either very poor or basically there's just treatment failure. In your case, what would you have attributed the treatment failure to? Was it just adherence or something else?
Yeah, so with me, the first two times that I had tuberculosis, I was not on treatment. I was not on
Okay.
ARVs. So that for those two times, it was attributed to the fact that I was not on ARVs yet. Then the time that I had, actually, even the first time I had TB, I had TB and the TB meningitis. So that was the first meningitis that I had. And then the second time I had TB, I just had TB, and then I was still not on ARVs. Then the third time when I had cryptococcal meningitis, I was still not on ARVs. So those were attributed to the fact that I was not on ARVs, and that's why I had those opportunistic infections. But then the third TB that I had, and actually before that, the other things that I've also suffered from 3 times are pneumonia. And the first pneumonia that I had, it was before I was on treatment. But the 2 second pneumonias that I had, I was already on treatment. So doctors were a bit perplexed on the fact that I was having these opportunistic infections despite me being on treatment. So now I'm beginning to look back and think that maybe the drugs that I was on were not really working well for me. Because initially I was commenced on, I remember there was nevirapine and I don't know what other drugs. Then when nevirapine and those drugs failed, I developed treatment failure from that. I was put on what was called, I think, a tripla, which had Truvada and was it amitriptyline or something like that? Yeah, and then that also did not work on me. And that's when they transitioned me to Truvada and Alluvia, which at the time, I think in 2008, was considered a second line, which later on became an alternative first line drug combination. But at that time, I remember when I was being transitioned to Alluvia and Truvada, I was told I was being taken in the second line because the first line drugs were not responding well to me. So when I developed the third tuberculosis, I was actually on Alluvia and Truvada. But the major challenge I had, even though I was on Alluvia and Truvada, was my CD4 count. It was never above 300. It was always below 300.
Right.
So that's why even doctors were not able to explain to me why it was like that. So I don't know whether it was the drug combination that was not working well for me. But even though there was that, I still ended up testing and I had still ended up having an undetectable viral in 2014. So maybe you, the learned doctors, would be able to explain as to why it was like that for me. But my CD4 count was just a nuisance. It was never going above 300. It's now on TLD that my CD4 count has even gone above 500.
Right. Now, Duba, before we proceed, let's get Dr. Mpeta here to clarify some of these technical issues that you were discussing. Dr. Mpeta, your mic is on mute. Could you unmute your mic, sir?
Yes, thank you very much.
Dr. Mpeta, you've been listening to Duba's story, and we'll get back to Duba because Duba has a lot to tell us. We have a lot of questions for her. But for the sake of the listeners, people are following us, she used certain words that I'd like you to clarify. One of the key terms that Duba has used is that her doctor told her that she's undetectable. Kindly explain to us what that means.
All right. Yeah. So maybe just before I come to that, I think Duba's story is quite interesting. You know, she's taken us through the journey that we have gone through in understanding HIV as we understand it today. You know, so she tells us a story between 2000 and 1995, 1998, when she had her first episode of tuberculosis. She didn't know what was happening. And then in 2001, when really HIV test was not readily available, counseling services were also not readily available, she had to undergo through that. And then, you know, test result had to take some time to come back. And again, because at that time, she couldn't access treatment because of the policy because of the ARVs were not as common as they are today. And then she developed another bout of tuberculosis, and then she had one of the severe forms of meningitis, cryptococcal meningitis, and then she was eventually started on treatment. And then how she had felt, and then people made some changes to her treatment to be where she is today until she has attained the status of undetectable. It's quite interesting because what she has gone through is what we have gone through, as the HIV program in Zambia. So come 1983, HIV is announced in the United States. Soon it spread across the world. There was no treatment then. All right. In 1989, in the US, they discover an already existing drug that was repurposed to treat HIV in the name of zidovudine. Then come 1992, 93, somewhere there, another one was added. 96, they added some. But soon resistance to treatment emerged, especially with the use of one ARV, and then we started the use of combination of ARVs. That was between 1996 and 2001. But still, the issue of resistance was there. So even when we were putting patients on treatment, they still experienced issues. Then came 2001, we started now treating HIV with 3 ARTs. And this is what we call HAT, or highly active antiretroviral treatment. So it was now a combination. Then we started, giving patients between 2003 in Zambia until it was rolled out to about 2007. We used to have a drug, like she said, nevirapine, and then we also had, zidovudine or stavudine, especially stavudine. It used to have a lot of side effects. So it was very difficult for a lot of people to stay on it and remain on it so that they can remain suppressed. So a lot of people used to skip the treatment, and then they would develop treatment failure, like she had shared. Now the treatment failure in this with the earlier ARVs was not readily recognizable. So you find that even when a doctor switches the treatment to another ARV, that still would not work very well. So Duba, probably the time that you were changed from nevirapine, you had resistance, and being changed to a tripler did not actually add any benefit to your ART. And these are some of the things that we have learned now, so much that today, if we are switching somebody because they have failed treatment, we are a bit more careful, and we want to know the history that they have taken for them to get there. So basically, that's what you had actually gone through. Now, with the discovery of the drug called DTG or dolutegravir, and the understanding of HIV that we understand now. So we moved, first of all, from saying, let's wait until somebody is severely immunosuppressed, where we say the CD4 should drop below 200, to start saying, no, let's start treating at higher CD4, because there was a benefit of treating people before the immunity goes down. We moved to 250, then we moved to 500. But we could still see that at 500, it was still late. Then we moved into the concept of test and treat. You test somebody, they test HIV, treat them, because early treatment was actually beneficial than to waiting. Now, later on again, from 2008, we started observing that those who have remained on treatment for a long time and their viral load is very low, they actually weren't able to transmit that infection to their partners. And these studies, these observations were made first in Sweden, and until so many studies were done, and eventually in 2014 to 2015, somewhere there, the WHO now had to recognize that when somebody is virally suppressed, there is no transmission. And hence, we started actively promoting this concept in Zambia in 2016. Now, what does it mean to be undetectable? So if you are HIV positive and you take your drugs consistently and you are adherent to them, the ARVs will start killing that virus. And the virus, the amount of virus in your blood will start reducing. Okay? Now, because the drugs are so effective, they'll actually wipe out almost all the viruses in your blood. So much, if we test using the machines that we have today, the machine is going to tell you that there's no virus in the body. Now, the virus is detected in the blood, okay? But remember that the virus actually is in the blood and in the tissues. So the machine is not able to detect the virus in the tissues, but just in the blood. So when you become undetectable, it doesn't mean that you are cured, but it just means that the virus that is circulating in blood has been wiped out by the drugs. Now, why are those wiped out? It's because of the drugs. So if you remove the drugs, the virus that is in the tissues starts coming into the blood and starts multiplying again. So that's why we are saying for you to remain undetectable, you still have to continue taking the drugs. So undetectable is where the virus has been killed by the ARVs and we can't see it using the machines that we are using today. And most of the machines today are actually able to detect, viral copies which are less than, which are like between 20 and 50. So if the virus or the viral load falls below 20 or 50, the machines can't pick them. By definition, undetectable is viral load, viral copies less than 50. So if the drugs are able to kill the virus so much that we can't see 50 of those, the machines won't be able to pick up, and it means that you are undetectable. So people who are undetectable, okay, it has been shown because the amount of virus in their body or in the blood is so scanty, they are unlikely going to pass on the virus to their partner through sexually or to the unborn child through mother to child transmission. So meaning that even if a person living with HIV who is undetectable was to have a child, that child is not going to have HIV. And this is one of the strategies that we are saying it's very possible to end HIV in future generations. And thanks to people like, Duba, who are a living testimony, because when we say this, people think it's just a matter of talk. I remember in 2014, I had a woman who was like you living with HIV and was HIV positive and was getting married to an HIV negative man. And now they had to ask about having a child. Actually, the woman was very afraid of passing on the virus to the child. And then we had to explain to them. And at 2014, it was really before we could start the campaign of undetectable is equal to untransmittable. So it was very difficult for them to really accept, and they were thinking maybe we are misleading them. But eventually they did, and we worked, with them through the pregnancy journey, delivery, and later on until the child, grew up and has got no HIV as we speak today. So this is how we have moved, and understanding HIV and the way we treat it over the years has actually evolved. That today we have got more knowledge about the virus itself. Two, the drugs are way better than they used to be, so much that it's very easy for somebody to take the drugs for a long time with minimal side effects. Then three, we now understand how to prevent, HIV transmission. Apart from putting all people who are living with HIV on antiretroviral drugs and ensuring that they remain on treatment and they are virally suppressed, we also give, prevention to people who might be at risk of, getting HIV in the name of PrEP. So all this combined together is how we are trying to see how we can end HIV within this generation. So that's basically about undetectable is equal to untransmittable.
Thank you, Dr. Mpeta. And if you are just joining us, we are discussing discordant couples. And this is a situation where two people are married and one person in the marriage is negative and the other one is positive, and they've chosen to live positively together. And we are also joined by Duba here, who is married to Edward, and they also have children together. And they have one child whom they have together with Edward, who is also HIV negative. So Dr. Mpeta has just finished explaining for us what being undetectable means. Now, Dr. Mpeta, I want also to ask you this question before I go back to Duba, because Duba needs to finish telling her story. When you say somebody is HIV undetectable, does that mean that their HIV test will come out negative?
All right. So the HIV tests, the antibody test, the rapid test, may not actually come out negative. There are certain circumstances where the test can come out negative, and here is why. So, because we have started the concept of test and treat, so if you test HIV positive today and you were just recently infected and you are started on treatment, your viral load will become undetectable, and there's also a chance that the antibody test can become negative. That doesn't mean the people who tested you were wrong, or they forged the results, or maybe you've been cured. No, it's because when you start treatment very early, people can actually lose their serostatus, meaning they can lose their antibodies to HIV. That doesn't mean cure. But if you have been infected for some time and then you start treatment later, the HIV antibody test will still be positive. The viral load will be undetectable. We don't say negative, but the machine is going to say, I can't see. And when the machine can't see the virus, then it writes undetectable. Or it can actually, the term that is usually used is target not detected. Or some machines will write less than 20 copies or less than 50 copies. Yeah.
Right. Duba, let's get back to you. Duba.
Yes. Yes, Doc.
Are you here?
Yes, I'm here.
So, Duba, let's get back to you. So, Dr. Mpeta has finished explaining the technical side of it. Let's get back to your story again. So, walk us through. So, you and your husband decided to get pregnant. At that time, you were undetectable. Now, yes. Was your husband on any medication?
No. From the time I met him, he decided he was not going to be on medication. Initially, when we met, can you hear me?
Go on. Yeah, I can hear you. Go on.
Yes. So initially when we met, because we were not aware about what it meant to be undetectable, and we were not even aware about undetectable. So, of course, we were advised to use protection. So we're using condoms. But then in 2014, when I was told I was undetectable and it meant that I couldn't pass on the virus to my partner, that's when we said, oh, okay. So it means that he doesn't need to use condoms. But we were told, I think that time they were encouraging double protection. So you use condoms and also PrEP. But then he didn't want to take pills. So he said, I'm not going to take any pills. So in a way, he took the risk and he did not take PrEP. To this day, he has never taken PrEP.
So your husband did not take PrEP?
No. To this day, he has never taken any PrEP. No.
And he has remained negative?
And he has remained negative, yes.
Have you two continued to use condoms, or you've stopped using condoms now?
We stopped using condoms in 2014.
So from 2014, you and your husband have not been using condoms up to today?
Yes, exactly.
And you stopped using condoms because you were undetectable?
Undetectable, yes.
And it is also because you are adherent on your treatment. You take your drugs every day?
Exactly. And one thing is that he also reminds me. For example, I've set an alarm on my phone to remind me the time that I'm supposed to take my drugs. So sometimes I'll be away from my phone and my alarm will go off. And he'll tell me to say, your alarm has gone off, you need to take your medication. Okay. And sometimes, even when maybe he has not seen me go to my body to take my medication, he asks me to say, like this morning, we had an interview on Movie TV. So I forgot to carry my drugs. Then I remembered when we were on our way, I said, I forgot to carry my drugs. Then he said, the first thing when you get home, you need to take your medication. When we just got home, he asked me, say, have you taken your medication? So in a way, he also reminds me to take my medication because he knows it's not only for my benefit, but it's also for his benefit. Because if I remain adherent and if I remain undetectable, he's also protected. But if I'm not adhering, it means he's also putting himself at risk. So he tries by all means to remind me to take my medication. In case he notices that maybe he may have noticed that I've taken my medication, he tries to remind me so that he's also trying to protect himself because he's refused to take PrEP. He said he doesn't like drugs. He says, I don't like taking drugs, so I'm not going to take PrEP. And the fact that you're undetectable, for me, is just to make sure that you remain undetected. Right. So that's all he tries to do to make sure that I remain undetectable so that he's also protected.
Now, has he fixed the car? Has he arrived home? Does he still have the breakdown? Because you said he had a breakdown earlier.
He had a breakdown. He said he had a tire puncture and he didn't have a spare tire in the car.
Oh, okay. I'm just checking to see if he has arrived because we want him to come and tell us also. Now, you said something very interesting. No, you can text him. You can text him. Let me also bring in Dr. Mpeta in the meantime, because you said something about taking PrEP. I want Dr. Mpeta to clarify that from the doctor's side. Dr. Mpeta, Duba has just told us that her husband was not taking PrEP while she was taking ARVs. Tell us about this issue of using PrEP with the discordant couples.
All right. Okay, so first of all, we have to understand that one of the effective methods of preventing HIV is where we say treatment itself. So treatment itself is a means of prevention of HIV transmission. Now, there are two aspects actually that we treat. We use treatment as a prevention. First of all, putting all people living with HIV on antiretroviral treatment and ensuring that they remain undetectable. That's one way of prevention. And this is where we are with regards to, Duba and Edward. Now, the other way is where you put people who are not infected on treatment, all right? So you find that somebody like Edward, he's not infected, but you put them on treatment so that if they have an encounter with somebody who is HIV positive, they actually don't contract the HIV, okay? So this is what we call PrEP or PEP. Now, PEP is given after somebody has got an exposure to somebody with HIV. But if it's before the exposure, it's called pre-exposure prophylaxis, and that's the PrEP. Now, PrEP is quite effective, all right, in people who are in a relationship or in marriages where the partner is HIV positive, but they refuse to take the drugs, or these are people who, when they take the drugs, they don't take every day. You know, there are just people who have difficulties in taking drugs every day. So their viral load will not be undetectable. So in such a circumstance, it's strongly advised that their partner should be on PrEP. Now, in a discordant couple like Duba and Edward, and the HIV positive partner is unsuppressed, it actually negates the need for the uninfected partner to be on treatment. And that's why it's not surprising from the medical point of view that Edward has remained HIV negative while the partner is HIV positive, for the simple reason that we are preventing HIV transmission to Edward by treating Duba. And this treatment has resulted in the positive or the desired outcome of undetectable viral load. So therefore, it means that Edward, as long as Duba remains undetectable status, Edward will never be infected with HIV. Now, in an event that Duba was to forget to take drugs for 2, 3, 4 days, it means the viral load will rebound and go up. In that period, it is highly recommended that the uninfected partner then starts, ART for prevention, which is called, PrEP, or pre-exposure prophylaxis. So this is how we use PrEP. So PrEP is desirable in people we are trying to prevent from acquiring HIV, especially if we don't know the status of their partners, or if the status is known they are HIV positive, but they don't take the drugs, or if they take the drugs, they are not adherent on treatment. Then this means that the uninfected partner should be on PrEP. So in the situation we are talking about, the use of PrEP becomes almost not needed because DUBA is undetectable.
Right. Duba, could you unmute your mic?
Yes.
So, Duba, has Edward arrived?
Just from calling him, he says he's not able to get here in like 20 minutes time. So he says he might only
We'll
be
still
here in
wait for
about
him.
20 minutes time.
I will still wait for him. We have time. Now,
Okay.
Duba, you were listening to Dr. Mpeza's explanation, right?
Yes, I was.
Right. So, where has Dr. Mpeza gone? Look, where did you go?
I'm here.
Right. So Dr. Mpeta was explaining the issue of PrEP and how PrEP is used
Yeah.
in a discordant couple like yourself. You've said that Edward has never wanted to take PrEP, and so
Yes.
far he's been safe. Now, what Dr. Mpeta is saying is that Edward has remained safe because you, Duba, you've been very consistent with taking your ARVs.
Yes.
And because you, together with Edward, are consistent with taking your ARVs, you've created a protection for yourself and for Edward.
Yes.
That's what Dr. Mpeta is saying. And he's also saying that if for some reason you stop taking your ARVs, then it means that Edward would have to be on ARVs also to protect himself from contracting HIV should you decide to have unprotected sex. Did you get that explanation, Duba?
Yes, I did. Yes, I did.
Right. Now, Duba, there's something else I need you to explain to us. So you are pregnant and now you have a baby. And you've been on ARVs. And Edward remains negative. And your baby is said to be negative. Did you breastfeed?
Yes, I did.
You breastfed for 6 months?
Yes.
That's
so
very
I did
interesting.
exclusive. Yes, I did exclusive breastfeeding for 6 months. I had my baby under PMTCT because I know now we have transitioned to EMTCT. But I had him under PMTCT, which was prevention of mother-to-child transmission. Now we have elimination of mother-to-child transmission. So at the time when I had my baby, the doctor that I saw at UTH said I needed to do exclusive breastfeeding up to 6 months and then abruptly stop breastfeeding at 6 months. But what he didn't know at that time was that the guidelines had changed. So despite me exclusively breastfeeding up to 6 months, I was still allowed under the then guidelines to continue breastfeeding even up to 2 years if I so wanted, provided that I was undetected, because I was already undetected by that particular time. So provided that my baby had received the ARVs prophylaxis, at that time it was 6 weeks, now they've increased to 12 weeks. So provided that my baby had received the ARVs prophylaxis for 6 weeks and then was on Septrin, I was allowed to breastfeed up to 2 years if I so wanted. But then the doctor that I saw at the time had the odd guidelines. What he knew was that I was only allowed to exclusively breastfeed up to 6 months and then abruptly stop breastfeeding. And then after abruptly stop breastfeeding, the baby now goes on solids and formula and any other food that I was supposed to give the baby. So on one of my under 5 visits, the nurse noticed that I was giving my baby formula from a bottle. Then she called, I think now they have what they call nutritionists that will guide you on what you should give the baby, on breastfeeding and so on. So she called me into her room and she said, I've noticed that you're giving your baby formula. Why are you giving your baby formula? Aren't you breastfeeding? Then I said, well, I stopped breastfeeding at 6 months. He said, why did you stop breastfeeding at 6 months? I said, well, I was told by a doctor at UTH that I was supposed to abruptly stop breastfeeding at 6 months. So he says, no, the guidelines changed. You're allowed to breastfeed even beyond 6 months. Even after the baby starts taking solids, you can continue breastfeeding, provided that the baby continues to take Septrin, and also you continue to be undetectable, so you can continue breastfeeding. And at that particular time, my breast had already dried up, so there was no chance of me continuing breastfeeding the baby. So I said, well, I didn't know. And I was following doctor's orders, and I stopped breastfeeding because of doctor's orders. So later on, after consulting, that's when I was told to say no. The guidelines had changed, and I was allowed to breastfeed beyond 6 months, but I was only able to breastfeed up to 6 months because that's what I was advised by the doctor that I saw at UTH.
Right. Dr. Mpeta, the issue of breastfeeding. Dubai here has had a baby, and she breastfed the child, and the baby did not get HIV. Could you help us understand that?
Yeah, so this is principally the same principle with married couples. So HIV could be passed through sexual intercourse or any other means, or from mother to child. Now, when somebody is undetectable, the risk of transmission, the benefit of undetectable in terms of transmission is both to the partner and to the baby. So in this case, where she was undetectable, even when she gives birth, the child remains at negligible risk to HIV transmission, either during pregnancy, childbirth, or even breastfeeding. So what this means is that undetectable woman with the status of undetectable virus, the woman is just like any other woman with regards to breastfeeding, with regards to pregnancy, and also child labor. The only difference is that during, when the child is born, we actually give prophylaxis, like she has said, for 6 weeks. Then after that, it's no prophylaxis for HIV, but just for Septrin. And then the child continues breastfeeding just like any other child, especially that the mother is undetectable. When the mother is not undetectable, then we take other drastic measures to prevent that child from having HIV. And then we extend the prophylaxis from 6 weeks to probably till when the child is safe to actually, from HIV, from the risk of HIV. So you see that guidelines change, and I think she's right to say by 2015, the doctor was right to tell you what they told you, because that's how the guidelines were. We only changed the guidelines in 2016. So 2016, that's when the guidelines changed for us to understand the way we understand about HIV transmission as it is today. So yes, a woman living with HIV who is on antiretroviral drugs and is undetectable can breastfeed just like any woman who is without HIV, provided that you take prophylaxis for the child as prescribed in the first 6 weeks, and then you remain on ART and remain undetectable. Then that child will have no risk, almost zero risk of contracting HIV from the mother.
Right. Now, we will be opening lines for people to ask us questions. They can ask either Duba, you can direct your questions to Dr. Mpeta. So please go ahead and put down your questions. I'll be able to put them up. And as we wait for your questions, let me ask Dr. Mpeta this one question. One of the people who's been following this discussion quite closely is also in a discordant relationship. And one of the stigma or misconceptions that has been out there has been this issue of saying in most discordant couples, it is the woman who is positive. Now, Dr. Mpeta, you are a clinician who has helped or who has been helping HIV infected people, including couples. what is the picture? What does the picture look like? Is it always women who are positive in these relationships?
No, I've actually been seeing, men who are HIV positive with HIV negative women. A number of people who come to our clinics are like that. And it's always encouraging to see, people living with HIV being escorted by their, HIV negative partners. It's always very encouraging. And you find that, they take the treatment together as a couple, and information is equally known between the two, which is quite encouraging. So the picture we are seeing on the ground is equally, is equal between men and women. And if there are any beliefs of saying it's only the women, well, I wouldn't say that. Yeah.
Duba, let me come to you as we wait for questions from our audience. So if you've just joined us, we are discussing HIV discordance, and today we are joined by Duba and Edward. Unfortunately for us, Edward had a challenge with his vehicle on his way home, and he's been trying to fix it for some time now. So as soon as he sorts out his vehicle and is able to join us, Edward will also join us. But for now, Duba is doing a fantastic job of discussing with us. So if you have a question, please go ahead and drop your question. Duba.
Yes, please.
What are some of the misconceptions or challenges that you have faced, either stigma or other issues that you faced with the fact that you are a couple who are discordant? Family, friends. What are some of the things that you've experienced that border on stigma or a bit of misconception?
Okay. So first and foremost, like when it came to the issue of me having a child, I was told, no, you cannot have a child because you're HIV positive. You're going to end up having a child who's HIV positive. When it came to me, the issue of breastfeeding, I was told, no, you can't breastfeed your child. Your child is going to end up being HIV positive. Then issues of me having unprotected sex with my partner, say, no, you cannot have unprotected sex. If you want to have a child, go for, is it IVF? In vitro, whatever, fertilization, because you're going to end up infecting your partner. So there are a lot of no-nos that I was being told because of the fact that I was HIV positive. Then also I would be told to say, no, people who are HIV positive do not live long. The ARVs that you're taking, you're not going to live very long. You're going to die because I don't know, for some reason, they believe that ARVs actually kill people faster. So those are some of the things that I would get from people. No, you're not going to live very long. You're going to die with these ARVs. Then some would even recommend some herbs and tell me to say, no, try to take this. It will help you. Or no, try to, there's this formula that has been going around and people tell you take this, it will help you and so on. So you kind of get this from people because they also have been misinformed somewhere and they feel that they're trying to help you by telling you to say, don't do this, or no, you take this, or you do that, and so on. So I've had that coming from friends, not so much from family, because I believe, I don't know, for some reason, my family have always let me make my own decisions concerning my health. Okay. They come in, yes, when I'm not well, they'll help out here and there. But when it comes to the decision whether I want to take ARVs, whether I want to have a child, they haven't really like stopped me from doing any of those things. They've let me make the decisions on my own. But usually I'll get this kind of pressure from friends, from people outside there. They'll tell me, no, this is not okay for you because you're HIV positive. No, you cannot do this, you cannot do that. For example, I'm into fitness. And I'll get people coming to my inbox to say, no, you're HIV positive. You can't do such kind of exercises. You're going to get sick, or you're going to, and they'll discourage me. One time when, I think it was 2019, I had pneumonia, and everyone was like, it's because of the exercises that you're doing. Stop those exercises. They're the ones which are making you sick. Then I said, what's the connection between exercise and pneumonia? Pneumonia is either a bacterial infection or a viral infection or something like that. It really has nothing to do with the fact that I'm exercising. And people were like, no, it's because you're HIV positive. No wonder and then you're exercising too much. No wonder you're having these infections. So I tend to get that from people. But then I'm one person that has taken it upon myself. Even when I go for my reviews, my ART reviews, I ask questions. I'll ask my doctor, what about this? What about that? And then my doctors will explain to me. I thank God that I go to a facility where they give me that attention. Unlike some people who complain to say the facilities that they go to, they can't even ask questions because there are so many people and the doctors are in a hurry to attend to as many people as possible. But the facility that I go to, they will give me an audience. I'll ask questions. Okay, so I'm undetectable. What does it mean? And they will explain to me. Okay, so I have treatment failure. What does it mean? And they will explain to me. Okay. For example, in the time that I had the third bout of tuberculosis, sorry, I had questions. I said, but I'm undetectable. How come I'm having the third bout of TB? Though for that one, even the doctors could not really explain because they said, well, maybe it's because your CD4 count is low because my viral load is undetectable. But then I was having a third bout of TB, but my CD4 count at the time was still below 300. So they said, maybe it's because your CD4 count is low, despite you having an undetectable viral load. So I go to a facility where I'm able to ask questions and I'm able to get the answers that I need. But of course, when you go out in society, people will tell you all sorts of things, myths and misconceptions. No, you can't do this because you're HIV positive. No, you cannot eat this because you're HIV positive. And they'll tell you all sorts of things. But I thank God because I go to a facility where I'll go and ask, okay, what about this? Is this okay with me? And they'll tell me, no, it's okay. What about this? And then they'll explain to me. So that has really helped me a lot. So yes, misconceptions, myths are there, but I think for me, they don't really move me because I have a mind that is very inquisitive and I ask questions because if somebody tells me this is red and I'm seeing it's green, I'm going to ask and say, is this really red or is it green? And then if somebody confirms to me that it's red, I'll say, well, you're wrong. It's not green. It's actually red.
Yeah. Thank you. Dr. Mpeta, there's a question here from Tamara Nambeye. Her question is, Doc, does it mean there is no need of PrEP if viral load is undetectable for the other partner?
Absolutely, there is no need. And taking PrEP in such a circumstance becomes rarely just a treatment of the mind rather than of fact. So Duba here and the husband are a living testimony to that piece of science.
Dr. Mpeta, to you as well. The question is from Cheetah. If a baby is tested HIV positive right at birth, is that result final?
Less likely. So it also depends on the test that is used. And it may not actually be final because it could be, if it's an antibody test, antibodies from the mother. If it's the PCR, it could be also, contamination of blood from the mother as well, especially if it's taken from the umbilical cord. So you really have to wait until at 6 weeks or later, then that's when we can say that this child is HIV positive. Although we do take drastic measures when we see that the HIV test is positive at birth to ensure that we do not leave any room for this child to deteriorate if indeed they're HIV positive, or to indeed make sure that we try to, make sure that they don't get infected in case this was just a contamination from the mother's source. So it's not final.
Right. Duba, this is for you. This is from Naomi Zulu. I salute you, Duba. You are a very strong woman. There's not very there. You are a strong woman and you have a king with you. God add more years. There's another comment here from Brenda Musenge Mukosa. I love her story. All right, let's see if we have questions here. Yeah, this is to Dr. Mpeta as well. Dr. Mpeta, there's a question from Cleopatra. The question is, Dr. Mpeta, why don't you form a platform where positive people can meet, relationships, that is, because the way she has explained that the other men abandoned her because of her status, I think it's so painful. So,
all right.
Dr. Mpeta, why don't you form platforms, dating apps for people who are positive?
So, first of all, what we have to understand now is that HIV is not a death sentence, and people who are HIV positive can actually live a fulfilling life just like those who are HIV negative. So, it will really defeat the purpose we are trying to achieve now to show that HIV is manageable today. If we are just to say only HIV positive should date HIV positive. The platforms that we should be forming are platforms like this where we explain and give people the correct information about undetectable, about transmission, about PrEP, and breastfeeding, and infant prophylaxis, so that people get the real information, and then they know how to take care of themselves, and also not to start believing on hearsay. I would also take this opportunity to talk about some of the things that people talk about. Duba shared here that a lot of don'ts, don't do this, don't do this. People will say all sorts of things, including like ARVs are shortening your life, which is not true. You know, we live in an era where if somebody doesn't know something, then they'll start a story, all right, and that story can go viral because of the easy of transmission of information we have today. Then we also have some people who undergo through a certain experience, and now because that experience was close to the story of HIV, then they'll associate that experience to the experience of HIV, and then they make it like if it was true. And because some people would have seen them going through that, then everybody start thinking that is true. It's not true. Let's take the approach that Duba has. Ask your doctor. If you're not a person who is readily going to facilities, find out from the people who know, all right? Ask Dr. Mjajati to bring experts. They talk about these things so that we are able to understand rather than we start spreading rumors when they are not supposed to be. So the platforms we should be creating, Cleopatra, is to give the correct information so that people are not afraid, and we don't exclude people living with HIV so that they can only date people with HIV. No, it should be people knowing the information about undetectable and untransmittable, and also prophylaxis and breastfeeding, so that people are able to live fulfilling lives without fear or without really believing whatever rumors are coming on.
Dr. Mpeta, this is from Harriet Spirit. Doc, is it possible that you can be undetectable with a low CD4 count?
Very, very possible. So the CD4 and the viral load are two different things. The viral load is the virus itself multiplying. The CD4 is a simulation of how strong your immunity is. So if you start HIV treatment late and your immunity is damaged, it might not recover fully to the way it's supposed to be. So you find that your CD4 will remain low, but your viral load will be actually undetectable. And I think Duba spoke to this when she said at the time she had the third episode of TB, she was undetectable, but the CD4 was low. So it is very, very possible. One of the reasons that happens is that, first of all, like I said, where you start ART late, immunity is damaged where it cannot actually recover fully. Two, there's also the aspect of opportunistic infections, like she had TB. So TB could have been the reason why the CD4 was down, or many other, opportunistic infection like CMV, hepatitis B, and all this. Then three, you could actually have a low immunity as well if sometimes certain people are not consistent with the drugs. You are consistent today, the viral load goes down, but the immunity recovery takes, later, or it's a bit slow compared to the CD4. And then sometimes we just don't know. Some people have got certain constitutional problems in their body that makes them not to respond fully to the treatment with regards to the CD4. So these are some of the reasons why you could have immunovirological discordant That's the term we use, the scientific term. It's a well-known phenomenon, and studies done here in Zambia actually shows about 30% of people living with HIV who are on ART have got immunovirological discordant. So meaning their CD4 is low and their viral load is undetectable. That is known, and it can occur in about 30% of people in Zambia.
Thanks, Doc. Duba,
Yes.
I've been wanting to ask you this question. Are your children old enough for you to have discussed your HIV status with them?
With my first child, the time I found out I was positive, I couldn't tell him. Because my doctor at the hospital told me to say, no, he's still young and he might not understand what it means to be HIV positive. And then he might actually feel like you're dying and it might end up affecting him in a very negative way. So I was told I needed to wait for him at least to be able to understand what it meant when somebody's HIV positive and probably even on treatment. So I think I was only able to disclose to him that I was HIV positive when he was 15 years old. And at that time, I'd already started treatment. So it was easy for me to tell him to say, I'm not dying because I'm on treatment and I'll be okay. So even when I explained to him that I was HIV positive, it was easier for him to accept and to understand that, yes, I was HIV positive, but it didn't mean that I was going to die because I was on treatment. And because I was on treatment, it meant that the treatment was this one way, prolonging my life. yeah. So I was only able to disclose to him when he was 15. And Mario, of course, is still a baby, so it's not something that I can even talk to him about. But for my firstborn son, I was only able to disclose to him at the age of 15 years when he was able to understand what it meant for me to be HIV positive and the fact that I was on treatment.
Right. The other question I needed to ask you is your first child. What is the HIV status of your first child?
He is negative.
Your first child is also negative. So both your children are HIV negative.
Yes, yes. Yeah.
Ah, excellent. Beautiful. Dr. Mpeta, there's an issue here. Doctor, is it possible that they will find the cure for HIV in the near future to help cure those who are positive? Or is there hope that the cure will be found sooner or later?
Yeah, thank you very much. So the cure is actually here. We have had a few people who have been cured of HIV. If we have heard of the Berlin patient, who was the first patient to be cured of HIV through a bone marrow transplant. Now, as you know, this was done, it was discovered accidentally where somebody was going for, a treatment for a cancer, and then he had to receive a bone marrow transplant. And then it was eventually discovered that actually they were cured. Now, for this bone marrow transplant to be done, you have to get a donor with a specific genetic mutation called Delta 32. So people who have got this mutation cannot get infected with HIV. And currently, the people with Delta 32 are very few in the world, probably less than 10%. And they are mostly found, of Western European ancestry. I'm not so sure of how many Africans actually could have these mutations. It hasn't been robustly studied, but as we know, as we are developing capacity for genetic studies in Africa, we should be able to have the answer soon. So that's why it's not readily available, because number one, it's high risk surgery. It also means stopping ARVs but continuing with immunosuppressive drugs. These immunosuppressive drugs typically lowers your immunity so that you don't react to this bone marrow. So it's like sorting out a problem with another problem. So that's why you don't see it being widely kind of practiced. Then there's also another piece of scientific discovery that has got potential to cure HIV, and it's called the CRISPR. So the science is there, where I'll give an example. Like you put a small scissors in, it's not really a scissors, but I'm just illustrating in unless people start saying Dr. Mpeta was saying that they're curing HIV with the scissors. So you put a drug, in you inject someone with a drug in someone's body. Now remember that the reason why HIV is very difficult to cure, it's because it infuses itself in someone's DNA, so it becomes part and part of you. So this drug now is able to get to your DNA and see the part where HIV has inserted itself, cut it off, and then mend your DNA, and it throws away the HIV. So it is a potential for HIV cure, but this science is high tech. It has got the potential for abuse. The good that it will do at the moment may actually not outweigh the bad, because if this technology falls in the wrong hands of people, it might actually do more harm than just the treatment for HIV. So there are several ways which scientists are trying to make it safer, and so that once somebody is cured, you remove the need to be on further treatment for lifelong. Because one of the reasons that the ARVs today are very fantastic, drugs, but the only issue is that you remain on them for the rest of your life. So the cure has to be in such a way that you don't need to take further drugs for you to remain, HIV free, or even, disease free, as it is in bone marrow transplant. So the science is there, but it's still being perfected to ensure that we are able to achieve the goal of curing HIV without somebody being, having the need to continue being on other treatment.
Dr. Mpeta, this is a question directed to you, and I think Alice has 3 questions, so you'll go through them very fast. Question 1, can people with HIV and AIDS take the COVID vaccine, since the ART clinics advise not to mix drugs?
Well, so people with HIV should take the COVID vaccine. And the vaccine is not the drugs. And we are not talking about where you start mixing herbal and ARVs. No, this is different. This is a vaccine to prevent you from getting COVID. So HIV positive patients should actually be able to receive COVID vaccine. Then 2,
is it always that when you have HIV, you are likely to have TB?
Well, it's not always. First of all, TB can, develop in one with HIV or without HIV. Only that the chances of one who has got HIV increases. I'll give an example. The risk of developing TB in somebody who doesn't have HIV is 10% in one's lifetime. So let's take an average of 50, 60 years. So you have got a 10% chance of developing TB in 50 to 60 years. Now, if you are HIV positive, the risk is 10% in a year. So you can see that if you live 56, almost each year that you live, you have got a 10% chance of developing TB. So the risk is just higher in HIV positive, but anyone can actually develop TB. And this I'll also speak to Duba. The third time you developed TB is not because the treatment was failing. Apart from the immunity probably having been compromised, it could have actually been the TB itself which lowered the immunity. Now, once you develop TB, the risk of you developing another episode increases because your lung has been damaged once. So because of your experience of having TB before, it actually puts you at risk of developing TB again, despite your CD4 being up or the viral load being down, because the TB has already somehow left some damage on your lungs. And this is what happens to TB. And just another question. I wanted to ask this at the end of the program, but since there was a question
this is at
from
the end
Alice.
of the program, actually. This is at the end of the program, so go ahead and ask.
Okay. Have you taken a COVID vaccine, Tuba?
Yes, I have.
Okay. Did
Yes,
you
I'm fully
experience
vaccinated with AstraZeneca.
Yeah. Did you experience any bizarre symptoms than the other people were experiencing?
Nothing. I didn't get any side effects on my first vaccine, and on the second dose, nothing.
Did you become a magnet? Were you attracting
No.
phones and spoons to your body? You see,
Nothing, Doc, nothing.
So you find Dr. Mjajati, a person goes, gets a vaccine, si anasambe, alinachive, patupi, then afakafona, but no, it's a vaccine. Endokageze chabe, we? What's the problem with people? And they come on Facebook, hey, I'm sticking, kageze chabe. We say endokageze olina matrena. That's just sweat, which you need to. Look at how people come up, Dr. Mjajati, look at how people come up with rumors. When we are growing up, we are being told, no, Panadol, they get human brains to make Panadol. Even now, COVID, now they are telling us it's a magnet. What's wrong with us? Just tell those people who are sticking things on their body, go and bath with soap. After you finish bathing, those things won't stick. Yeah.
The spoon is sticking. Can someone is not bathing? They haven't bathed.
Yes, they're just telling us they haven't bathed.
Do have you heard?
No, I've heard.
Why you wankalache magnet work? This is Tinakareko magnet. Kasambi.
The spoon is sticking and the phone is sticking. Can someone has it?
Tanasambe cha. Yeah.
Dr. Peter,
It's important that people realize that there are certain people whose job is actually just to scare people. Whose job is to generate misinformation and let people be scared, or because I've got fears of a vaccine.
Edward!
Oh. Just a minute.
Edward,
just a minute.
Man. Duba, could you put the camera properly?
Oh, when
Duba,
he comes, it's coming.
properly.
It's coming.
Before we wind up,
he just has to do something outside. It's coming.
Yeah.
He's coming, right? So Edward needs to answer a few questions. Yeah, so go on, Doctor.
So Dr. Mjajati, because I've got a fear of a vaccine, I feel the other people should have the same type of paranoia that I have. And I start, just telling people, why is it that you are the only one who is being targeted? Because you are afraid. Then you want other people to be afraid. No, the whites wants to kill us. Kill you where? No, the people who have taken the vaccine, in 2 years they will die. Who was there in 2 years? Who traveled in time to see that everyone has died? Who traveled?
Maybe chaps are time travelers. You never know.
And you can't start saying the things that you don't know. Now,
maybe chaps are time travelers. You never know. So,
exactly.
So let's wait for Edward to settle. I think Edward has settled, which is good. Edward has settled, which is good. Edward, can you hear us?
Yes, we can get you loud and crystal clear, Doc.
Thank you, Edward.
Fantastic.
We've had a fantastic time with Duba. She
Yeah, I
was,
was following the program.
you were following. She represented you
Yes.
very well. Very well. So, what happened to your car?
It had a breakdown. Unfortunately, for the first time, I don't know what happened. I wasn't even supposed to go out because during the day in the afternoon, for some reasons, I don't know, it failed to start.
Oh, no.
Then around 16, 17, I managed to start it. Then went out somewhere around the Ngwerere area. Then from there, I had a tire burst. Now finding someone to help me replace the tire that busted, that was a challenge.
Right, right.
Yes.
So, since you've been following us on Facebook, which is good, we just have a few questions for you before we wind up. We have
Okay.
Dr. Mpeta here. He's an infectious disease specialist. He was bringing us up to speed on the technical side of HIV and things like that. And
Okay.
Dula, of course, was explaining to us your experience as a
Mhm.
couple and issues that you've gone through. Now,
Okay.
so tell us, so for you, when you met Duba,
Mhm.
what's your side of the story? How did you meet Duba?
So Dua, we met at a concert at Mulungushi International Conference Center, where Kings Malembe Malembe was launching his Pie album. That was in 2013. So I didn't want to go to that. Didn't want to attend that conference, the concert. Sorry, but a friend of mine forced me. I tried to give all sorts of excuses, but that did not convince my friend. I had to attend it. That's where I met Dua, who equally did not or never wanted to attend the conference, but she had a friend, or she has a friend, who also forced her to attend that concert. That's where we met. We became friends from there.
Right,
Mhm.
right. So anyhow, so Duba told us how you ended up proposing. You were friends for a long time. Now tell
Yeah.
me, what was going through your mind the first time she told you she was HIV positive?
So we became friends instantly. Then we would chat like the whole night on phone. We within the short space of time, we became like people who knew each other for years. And our intentions were clear. She knew that I was interested in her, and somehow I knew that she was interested in me. So before I would even take a step further, she knew. Then she was bold enough and kind enough to open up to me. That I know she told me that she knew where this whole thing was going and where it was taking us to, and she wouldn't want me to find out after we are into a serious relationship. So she told me everything. She opened up. She had some bottles of ARVs, and was another bottle of TB treatment. So that's how she told me. She showed me the bottles. Then she opened up about everything. Of course, at first, because of the way she looks, I'm sure you know, she doesn't look like someone who's HIV positive. At first, I thought maybe it was an excuse of chasing me away. I thought it was just a trick, but she showed me the cards, the hospital cards. That's when I knew that, oh, okay, this person indeed is HIV positive. Anyway, moving forward, I don't think I had second thoughts because I was already into her. I loved her, and I was ready to be with this woman who we became friends instantly. We were like buddies. We were like we knew each other for years. And I told her that I'm okay with this whole thing. I'm okay with your HIV status. I'm okay with the fact that you are on taking your TB medication. And of course, at first she thought maybe I was just joking or I was just trying to buy time. And I know deep down she gave me a period, maybe a month or two, then I would disappear. But days turned into weeks, weeks into months, months into years, and here we are today.
Mm. And at no time did you experience or express any fear or concern on your part?
Did I? I don't think so. Not what I can remember of. I think I was ready. Maybe it's because of the information that I had received even before I met Duba. The truth is,
What
where
information? What information did you receive before you met Duba?
um, have attended some workshops about HIV, and I knew that HIV is not as deadly as people puts it. Though then we did not know about UU, but I knew that with proper care, with proper medication, if she adheres, then we'll be okay. She will not be experiencing any kind of sicknesses. So I think that was one of the reason why I decided like to give it a go ahead and try things and see how things might go between the two of us.
Now, we've learned that you have a child together and that
Hmm.
you've been having unprotected sex as a married couple, and
Yes.
that in the process, you've not contracted HIV.
Hmm.
Walk us through your side of the story on that.
So after we met, at first we agreed that there will be no sex before marriage. But you know how it is. Every time we were together and the bond was just too much, she would come by my place. She would spend nights there. She would come for weekends. I would equally visit her. And in the process, we found ourselves sleeping together. Of course, the first 3 or 4 months we would use protection. Then I think just before a year, that's when her doctor told her about you. We were both not sure, but we said, why can't we try? And the moment she went to do her medicals, she was told that her viral load was undetectable. So we said, why can't we try and see what will happen after after this? That's how we tried. I know we're taking a risk, but I think I was ready for anything.
But again, it was a
So
calculated risk. It was a risk with information and knowledge, right?
exactly.
Right, right.
So
So,
from 2014, I think that's when we stopped using protection. And from that time up to now, we've never used any kind of protection.
so you stopped using protection because you had the knowledge and the information that it is now safe for you
Hmm.
and your wife not to use, condoms.
Hmm. Yes,
And it was safe because she is undetectable. Now, she told us about
undetectable.
how you help her take medication. How do you manage to do that? She says you are very good at
So,
reminding her to take medication.
yeah, today we had an interview at movie TV, so we had to leave home early in the morning, and because of that, she forgot to take the medication. So I'm like her second alarm because she has set the alarm on her phone every day at 8. The alarm will go off. But at times you'll find that maybe because we are late going somewhere, maybe she's going to the gym, of course, because she's mostly at the gym in the morning. She forgets to carry the medication. She just told me that, boy, unitaka remind tikabwera ku nyumba tukutinga manka. I'm very good at that. At times, even when we're at home, I'll hear the phone ringing, the alarm will go off. Nzamwitana, time ya mankwara ya kwana, come you take your medication.
Mm.
So I
Now, there's
know
something,
I don't.
Dr. Peter, there's something
So,
I have observed with the discordant couples that I've dealt with. There's a characteristic to that I've observed, and I'm sure Duba and Edward, you also know other. Do you know other discordant couples as well, other than yourselves?
yeah, well, we do, though most of them are not open about their HIV status. But we do. I think the famous one is Teresa and the husband. I don't know whether you know Teresa.
No,
Yes,
no, no. I'd be happy to
Kanjel.
meet them. Would be happy to
Yes.
meet them. Would be happy to know their experience as well.
Yes, so I think those are one of those who are open about their discordant marriage, but we've dealt with a lot of people in our inbox on phone and social media who are in a similar situation. Though most of them they don't want to come out in open. So now coming back
Yes,
to
of
your
course.
earlier question about why I always try to remind Duba to take her
Yes,
medication.
yes.
I don't do it for her. I also do it for myself because I know that the moment she'll start skipping, then the virus may start to replicate, and she may infect me. The best way to protect herself and to protect me is when she adheres to medication. So every time she misses, then she puts both of us at risk. That's the reason why I always try my best to remind her.
Beautiful. Such a beautiful love story. Dr. Peter, I was just trying to remark that one of the things I've observed, most discordant couples I have met where they have disclosed to each other and they're taking drugs and everything, I've noticed that the bond between couples is very strong. Have you observed that, Dr. Peter?
Yeah, truly. Remember, if you are open in a relationship, you are open about everything. Everything becomes very easy. It's very easy to work together. It's very easy to remind each other to take the drugs. It's very easy to do things together. So, being open is number one. Having the correct information is the second. And then the third is accepting the situation. And those are some of the things that really helps couples to remain positive and also, to remain, committed to treatment as prevention.
So, Duba and Edward, um, we have observed that discordant couples, where they are very open about their status, they are usually very strong couples, marriage wise and relationship wise. Is that true about your relationship, the two of you?
Dog, the truth is, every marriage has its own challenges, and that's the question that most of outsiders, friends, and those that see us from afar ask us: Do you people ever fight? Because the bond seems to be too strong. The truth is, we fight. We are two different people from two different backgrounds, so we always have our own misunderstandings. We always have those moments, but it is all about how quick we resolve our issues and how willing we are to compromise to a certain level so that we just try to agree and move forward with life.
And maybe the other thing is we started out as friends. So I think that really laid a very good foundation for us because we're able to communicate at that level of being friends. So even when we transitioned into being in a relationship, we had already laid the foundation of friendship. And so we continued with that friendship even in our relationship. And even into our marriage, we continue to be friends. And so I can say anything to him. He can say anything to me. We'll call each other all sorts of names and we'll laugh about it because to us, I'm talking to my friend. Okay. In as much as yes, he's my partner, but I am talking to my friend. So because of that kind of friendship that we've developed between the two of us, it kind of helps us to create a strong bond. And even when we do have our arguments, our differences, it's easy for us to resolve them because I'm talking to my friend. So yes, we are coming from two different backgrounds. He's likely to step on my foot. I'm likely to step on his foot. But then, if we were going to talk as friends, it becomes easier for us to resolve whatever differences may arise between the two of us. Yeah. So maybe that's the reason why maybe you may have noticed that there is this bond between these cornered couples. Maybe it's because they start out with that foundation of friendship and they build from there. And because the foundation is that of friendship, they continue to be friends even in their relationship and even in their marriage.
And the other thing is mostly people who are in such a situation, their love is unconditional, dog. It has no strings attached. You just love the person the way they are. That's the reason why you've accepted in the first place to be with someone who's of your HIV, different HIV status. So the the bond, then there's unconditional love also involved there. Maybe that's the reason why we seem to be so much close and so much into each other.
You've just given me goosebumps. I'm telling you, you've just given me good goosebumps. Your comment has just brought tears to my eyes. Yeah, thanks for sharing. That's so
And we
touching.
drink a lot of water.
You drink water as well.
Water also helps.
Water helps to be like
Water,
this.
water helps to form the bond. Yeah.
Yes.
Yes.
You guys, thanks so much for sharing. You are touching so many lives. This conversation can go on and on. So let's go through our last and final comments before we close. Let me start with Dr. Mpeta and then end with the couple. Dr. Mpeta, what's your final message to uh, the people who've stuck with us up to this time? Quite a lot of people have stuck in with the conversation. I'm quite amazed today. So, Dr. Peter, what's your final message? What's the take-home message? If people should forget everything we've discussed, what should they take home?
When you take your antiretroviral drugs, your viral load is going to be undetectable. Then it means that you can't transmit to anybody, either to your sexual partner or even to your child. So the bottom line is treatment can be used as prevention, and therefore people who are living with HIV should ensure that they consistently take their ARVs so that they remain undetectable, so that we reduce HIV transmission in the population. And as we are in the month where we are, kind of celebrating HIV and the successes we have made so far, today I'm glad to report that we are continuously improving with the type of drugs that we have on the market. And in future, and I should mention this to Duba, that coming in a few years' time, we will have, instead of every day, but we are going to have, every 2 months jab, where you just get a jab and, you don't need to have to take every day. And where we are going, there will even be just, 2 injections in a year. And that time, trust me, is so near than you think. And it will be a game changer, both for treatment and prevention. And we just hope that Zambia will be able to, jump on this move very soon. Yeah. Thank you.
And to the couple, what's your final message? I don't know who's going to speak first.
Well, let me start first. Okay.
Go ahead.
Yeah, my word of encouragement to someone who still looks down on someone who's HIV positive is that HIV is not a disease, and HIV is not a death sentence. Someone living with HIV is like any other person, is just as normal as you who's HIV negative. We don't have to look down on them. We have to love them. If at all you find yourself to be with someone who tests HIV positive, love them even more. Encourage them to start medication immediately. And with TLD now, I think I know it takes about 14 to 21 days for them to reach viral suppression, meaning that you can live as a normal couple. And that's what I always tell people. You can live as a normal couple, provided that you encourage your partner to adhere to medication and you follow all the laid down guidelines given by the medical personnel like Dr. Francis Mopeta.
Duba, your
Yeah.
final
So,
thoughts?
as a person living with HIV, for me, my advocacy is in trying to make sure that people who are living with HIV adhere to their medication. and attain undetectable levels. And for those that are HIV negative, my advocacy to them is for them to remain negative. So I know Dr. Peter probably didn't talk about the prevention methods, but of course there are prevention methods that one can use to stay HIV negative. I think he did mention about PrEP. Okay, there's also PrEP in case you find yourself exposed. There's also condoms, and I think I read somewhere that even UU now has been listed as one of the prevention methods of HIV transmission. So for those that are HIV negative, stay negative. Those of us that are HIV positive, let's adhere to our medication. We attend UU, and come 2030, we are ending AIDS. Those are my final remarks.
Duba, Edward, Dr. Peter, on that note, we are going to end AIDS. And ladies and gentlemen, thanks for joining me. And to the people who are following us, thanks for staying along. And for you out there who is watching this, share this video as widely as you can. We need this information out there. We need everyone to get the message. Good night and enjoy the rest of the evening.